So my name is Dr. Benelema Vimbela. I'm a grade 1 medical officer, currently fun employed, so that's how I find myself here. I have a lot of time on my hands. Got a lot of time on my hands to do fun things like this. What else would you like to know?
Okay, I don't know if you know, there's the thing called I'm a 1K nurse. Do you fall under
Okay.
there? Would you say you're a 1K doctor, you?
I'm at the cusp millennial, 1996.
Uh-huh.
So what do we
1K.
ouch.
Yeah, so it goes along with behavior. You know that,
Okay.
girls will go there and then the nurses are like, were you doing things? Why are you here? You see,
Little
basically,
bit.
a little
I'm
bit.
kidding, I'm joking. In my mind, I am judging, guys. Let's be honest.
Why
I'm
are you
joking. I'm
judging?
joking. I'm joking. I'm joking. I get it. No, I understand. I'm far from
Mhm.
that. No, far from 1K medical practitioner. No.
So I'd like to know, how do methods like IUD, implant, pill, and injection work in the body?
Okay, so contraception is quite a broad topic. Uh, Obviously, where do I start? The best way to think of it is you have short-term ones and long-term ones, right? And then even in when you break it up into that, you also still have what we call hormonal ones and non-hormonal ones.
Yeah.
Okay, so most simple would be non-hormonal ones. Those are the basic ones that we all, men and women, engage in: condoms, barrier methods.
Yeah.
Obviously, we'd all love to say contraception starts at abstinence because you're definitely never going to have a child if you're not, unless you're Virgin Mary, I don't know.
Yeah.
But we start there. Those are non-hormonal contraceptions, condoms, male, female. I think I've heard of cervical cups that where they block sperm from entering the cervix, stuff like that. And then your copper IUD. Copper IUD inserted, I think it can last anything between 5 to 10 years, depending on the make. And that works because it's known that copper is, what do you call this? Toxic to sperm. Exactly. So that's non-hormonal. It doesn't have any hormonal ingredients in it that will affect, what do you call this? Contraception, right? I mean, conceiving rather. Then you have your hormonal ones, short-term, long-term. Short-term, your pills, right? We have combined oral contraception. That's, I think, the most popular,
Yeah.
right? It has both estrogen and progesterone. And there's different phases of a cycle where it would work to stop you from getting pregnant. Uh, uh, I won't get into detail. That's it's pathophysiology and blah, 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 but, or physiology rather, but it's either going to stop you from, what do you call this? From the sperm and the egg from thinking, what do you call it again? Remind me. Yeah, you're the one. Yes, fertilization, implantation, all those Asians, different phases, right? So it can work, but mostly, generally, we'll say, obviously, you need a very well primed endometrium and all this stuff for the egg to implant and all that stuff. So
Yeah.
the combined, not combined, but the hormonal stuff works to mitigate that. So prevents the endometrium from thickening well enough for the egg to implant on it. It'll make your cervical mucus thicker so that the sperm doesn't penetrate. It blocks those things. And with the hormonal pills, you have obviously the ones that are combined, but you have the progesterone only ones as well. So they work differently, affect people differently. Um, those are short term. You stop them, some of them within a week. We can expect you to be fertile, but sometimes it takes up to a year, right? Especially with stuff like Depo is short term, but like once you stop, it can take up to a year for fertility to. We expect that, okay, at least after a year you should be proper, smooth sailing. You can get pregnant, but different people, different strokes, different folks. We all work differently.
Yeah.
Uh, I think I would say Depo is also still short term. 3 months is not a long time. Yeah, you get an injection, 3 months, you blink, and you need to go get another one. That's also short term. It's also hormonal, of course. Then you have the implant, goes into your arm. That's a progesterone only. Only release progesterone. Same mechanism. thickening the cervical mucus plug, making your endometrium not as well primed to receive and house an egg.
Right there.
Yeah.
Okay. In that situation, I'm just gonna give you like three situations. So the first one is someone who's a teenager and the parents are coming to you on some, okay, we've noticing our daughter is sexually active. What's the correct birth control they can go? Like some, like
There is no correct.
not correct. I can
Yeah.
say one that fits into their lifestyle, if that makes sense. As a
As a
teenager.
teenager,
So no
I'd choose
egg.
something more long acting
Okay.
because you're a teenager. You think you know something, but you don't. And I wouldn't put the responsibility of remembering to take a pill. A pill burden is a thing, even if it's like a choice. Contraception is a choice pill, right? You take it of your own volition. It's not like you are sick, right? So I wouldn't pill burden. Already, people who have conditions, medical conditions, have to remember to take a pill every day. Now, this is a choice, and I wouldn't put that responsibility on a 16 or teenager in general. So I'd probably opt for something more long acting, like an implant. Um, all of these contraceptions have side effects, so your desire to be sexually active has to outweigh
Those things.
the fact that has to outweigh
Okay. Since you
side
sorry
effects.
to cut
No,
you.
no problem.
Since you touched on side effects and stuff, so we're just gonna read on some experiences people have
Have
while
had, yeah.
preventing it. So the first one is, why is my skin breaking out while I'm preventing?
Okay.
Yeah.
Again, what preventing using what?
Okay, let's just assume.
We'll say if it's the hormonal pills, expect something to happen. Not everyone's gonna break out. Not everyone's gonna gain weight. Not everyone is gonna have amenorrhea where they don't have a period. Not everyone is, other people bleed more. Some people bleed less. Something is going to happen. Remember, the body has endogenous estrogen and progesterone already. Now you're putting an additional dose, something is going to shift,
Okay.
right?
Is it normal to not have a period when you're on certain methods that can be your IUD or implant?
It is normal. Some people bleed less, some people spot, some people bleed more to the point where they remove it and opt for something else. I think you've heard stories where people are saying they're not even on anything anymore because they were bleeding so much. We love combined oral contraception to help combat that. It really helps regulate, like even if you weren't on any contraception and you were experiencing heavy bleeding for long periods of time, you basically don't even know how long your period is. You can't you can't calculate what your cycle looks like. We put you on our contraception, the pill, just to combat that, re-regulate you. It's like a great reset button. It really helps with a lot of things. We use it quite often.
Okay, I think you explained the side effects part and all of that because different strokes for different people.
Really, really, really.
Yes.
Yeah. There's not a general, I will never say with, especially contraception, there's not one single side effect that I'll say every single woman who's on it will experience.
Exactly.
No.
Question, man. Sorry. The question that I have is that they say wait it out sometimes. The side effects. How long do you wait it out to say, okay, maybe now I need to go consult, take it serious?
Wait, what out?
The side effects.
Okay.
Let's say maybe you're bleeding and maybe it's normal, it comes with the birth control, but where does it get to a point where it's like, okay, now I need to do something about
Anything that affects your daily functioning. If it's an inconvenience, I wouldn't even say wait it out. If you can't bleed through your pants when you need to be out and about, that can happen once, and you're like, actually, no, I need to see someone because this is abnormal. But I would say we usually, I wouldn't say we, but I would say a month to 3 months, depending what it is. One breakout once, a hormonal breakout's okay. It happened once. Is it recurring? Does it go away? Is it only getting worse? There's so many other questions I'd have. Like this, now I have acne, it appeared. It's never gone away. It's only getting worse. Of course, go consult. But if we need to see, or then if it's like bleeding, okay, I bleed for 10 days now and it's heavy. I use 4 pads a day and this has happened for 2-3 months in succession. maybe go see someone.
Yeah.
And there's other options to explore. Of course, yeah, you'll discuss with your medical practitioner, provider, whoever's helping you, because cost effective, they're free options, there's this, there's that, many things, other factors that will ultimately affect your decision.
Yeah.
Yeah.
Makes sense. So there's this whole story. I don't think anyone is going to get over it.
Okay.
That if you're on an implant or IUD, you can fall pregnant, and the baby's gonna come out holding it.
Funny,
IUD, ne?
funny story,
Yeah, the
funny
IUD.
story. 2 weeks ago, I went in for an emergency C-section.
Mm-hmm.
We delivered the baby. Obviously, we cut you lower like your lower abdomen. Baby removed, sew mom back up, and then when we're done, we usually open your legs, like just rub your uterus to expel any clots that were remaining, whatever bleeding. And lo and behold, boop, implant, no, IUD comes out. But she did say to me,
Damn.
because before we put her to give her the spinal, we have to put in a catheter for her. So I was explaining that procedure, that I'm going to do it, introduce myself, all that stuff. She's like, no, but did doctor tell you that I've got a IUD? I'm like, well, okay, but you're pregnant. My brain was just like, wait, what?
Yeah, what's
But I was thinking, no, you're just higher for pain. And you just, you know what I mean? And then I explained to her, no, it's okay. Even if that's the case, urethra and vagina, two different things. Yeah, that is down there. I'm going somewhere else, right? She's like, okay. I put in the catheter, everything's fine. When we finish, her thing comes out. Mama, you were serious? Yes. So how long have you had it? She had it for 4 years.
Ooh.
Mirena usually does last 5 years. And it has a certain dosage. I don't know the numbers correctly now. I think it's got 52 milligrams of. Is it combined? No, I think it's progesterone only. I'm not sure. Don't quote me on that. But
Yeah.
it's got a certain dosage and it releases constantly. So I think hers might have been defective, probably.
Yeah.
But it did work for 4 years. It did.
So,
It did work.
so that's to
works.
clarify, IUD is not a barrier method.
No.
It releases hormones.
Yes. Copper IUD is, we don't say, barrier method is condom. That's a barrier. The cervical cup is a barrier. The intrauterine devices are just classified hormonal, non-hormonal. Copper is non-hormonal. Copper works because it's toxic to sperm. The other one, Mirena, that's a hormonal one.
Okay.
Yeah.
So what happened? How did she get pregnant? Like, I'm still trying to understand.
So it was just for 4 years.
Yeah, she said she put it in 2021. And she never had her period. But then, beginning of this year, she started noticing bleeding. And then I said, well, why don't you go to doctor and say, hey, by the way, because you're still active sexually. Lo and behold, then the bleeding stopped again. Why did it stop now? Because she's pregnant.
So is it body change? Like, what happened for the bleeding to start?
I think it's the Mirena stopped working. Yeah. That should have been her sign to check. Yeah, because if you put something in 2021 and all of a sudden in January of 2025 you're bleeding, that should be for 4 years. This has been. I haven't experienced. You've forgotten what it feels like to
So
bleed.
it's similar to an expired implant, if that makes sense.
Basically.
Oh, okay.
Yes. Don't everything. Remember, that's what I'm saying. Kids, stay away from adult activities. No one would want to put that responsibility to remember to do this. Adults are forgetting. She was like, oh, I'm just bleeding, whatever. Husband was still husbanding, and baby appeared. There's a
So-
baby now.